What is a genioplasty?
Genioplasty is the medical term for having a procedure that changes the appearance of the chin. So in other words, if you think your chin is too strong, you can make it smaller by taking something off. And if you think it is not strong enough, you can make it, the chin stronger by putting something in or by moving the bone forward. So basically, more chin, less chin, wider chin, thinner chin, or let's say vertically along, an augmented or reduced chin. This is what you try to do with a genioplasty.
Can I choose the shape of my chin?
To a certain extent, yes. You probably never get it spot on, but if somebody says, you know what, I do think that my chin sticks too far out and is too wide, I think I can bring it more in and make it thinner. What is at the moment very popular, especially with the girls, not with the men. The men usually don't like it too much. But the girls now, there seem to be a few models that have this very heart-shaped type chin. So that is something which is quite popular now. And to a certain extent, you can do that. Obviously, it needs to be a bit in proportion to what else is, basically anatomically, available. But to a certain extent, you can accommodate these shapes. Never spot on, but at least most often you can get a certain, bit in that direction. Mm-hmm.
This sounds like much more of an invasive procedure. How much time will I need off work for that, recovery time?
Yeah, I mean, it's true what you say, that people, as soon as they think, oh my God, somebody's cutting my bone and moving something there from A to B, they assume that this is more invasive. From a surgical perspective, it's a bit different. Bone actually heals usually quite well and is a bit more predictable than soft tissue is. So I don't see it that... I think to work with bone is quite nice. Time off work, genioplasty, 1-2 weeks, I would say.
And how will I look after surgery?
I do some strapping on my patients, in other words, elastoplast or some very sticky tape. I put it across like so and the other way around, so you're taped basically. With a man, the beard will push this tape off after a while, but after, ideally it would stay there 10 days. 10 days would be good, 10, 11 days, and then it's slowly peeled off, ideally by the nurse or myself. Because you don't want to disturb the healing. If you put a chin implant, for example, in, so if you decide for the not for the bone type technique, then you want this chin implant to be stable and not to be moved around. And although you fix these chin implants from inside, you should still be careful until the body has formed a nice scar to hold it nicely in place.
This may sound silly, but can I eat?
Oh yeah, well, you can eat, not anything spicy or very sour. Ideally, it would be liquid chicken type soup for the first few days. You need to, keep your teeth clean, without being too vigorous here where it was operated, and you should definitely not smoke. But yeah, you can eat. You don't need to starve yourself.
And pain, is this very uncomfortable?
Not much. Unless you're unlucky. I only say what the average patient would have. Pain is usually minimal after genioplasty. There are exceptions, but most of the time it's astonishing that the procedure, which seems a bit more invasive, does not necessarily cause you more pain than procedures which seem less invasive.